What is the psychosis spectrum? Disorder's differential diagnosis. Imagine trying to solve a puzzle where many pieces look similar but fit into different pictures. That's what doctors do when they diagnose psychosis spectrum disorders. They need to figure out if someone's symptoms are caused by schizophrenia or something else. This process is called differential diagnosis. It's like being a detective, ruling out other possible causes before settling on a final diagnosis. First, doctors look for signs of substance-induced psychosis. Certain drugs like cannabis or hallucinogens can cause hallucinations or delusions. If someone has recently used these substances, their symptoms might be temporary. A urine drug test and a detailed history help determine if drugs are the cause. Sometimes, withdrawal from alcohol or other substances can also trigger psychosis, so that needs to be checked too. Next, medical conditions can sometimes cause psychotic symptoms. For example, neurological issues like Wilson's disease or brain tumors can lead to hallucinations or strange beliefs. Blood tests, brain scans, and physical exams help identify these medical causes. If a medical illness is behind the symptoms, treating that illness usually improves the psychosis. Mood disorders such as bipolar disorder or major depression can also include psychotic features. During severe mood episodes, people might have delusions or hallucinations. The key is to see if the mood symptoms happen at the same time as the psychosis or if they come first. When mood symptoms and psychosis are present together but independent, the diagnosis might be schizoaffective disorder. Another group of conditions includes brief psychotic disorder and schizophreniform disorder. These are short-term psychoses. Brief psychotic disorder lasts less than a month and often happens after stressful events. Schizophreniform disorder lasts from 1 to 6 months and may turn into schizophrenia later. The duration and pattern of symptoms help distinguish these from schizophrenia. Personality disorders can sometimes look like psychosis. For example, paranoid personality disorder involves suspicious beliefs, but these are not persistent psychotic symptoms. Schizotypal personality disorder includes odd beliefs and social withdrawal but lacks the full-blown psychosis seen in schizophrenia. Borderline personality disorder may have transient psychotic-like episodes but with different features. Other psychotic disorders include delusional disorder, where someone has fixed false beliefs, and shared psychotic disorder, where beliefs are shared with someone else. Sometimes, neurodevelopmental disorders like autism can have overlapping symptoms but are different diagnoses. Finally, the timeline and level of functional decline are important. Schizophrenia requires symptoms to last at least 6 months, with at least 1 month of active psychosis and a noticeable drop in social or work skills. If symptoms are brief or do not affect daily life, the diagnosis might be different. In the end, diagnosing schizophrenia involves carefully checking how long symptoms last, what kind they are, and how they impact daily life. Doctors use history, physical exams, lab tests, and sometimes brain scans to make sure they are not missing another cause. This thorough process helps ensure the right treatment plan is put in place.